Hi there, Dr. Janelle Louis here, and this is our second video in our video series on how hormonal disorders can masquerade as mental health concerns. In this video, we'll be talking about how suboptimal thyroid function can cause or contribute to mental health related symptoms. And specifically, this is even if our patients have a normal TSH value. Okay, you won't want to miss this video. Hey there, Dr. Janelle Louis here, and if we haven't met, I'm going to take a brief moment to introduce myself. I'm Dr. Janelle Louis. As I've mentioned, I am a licensed naturopathic doctor, and I'm also a board-certified psychiatric mental health nurse practitioner. And I am the author of 2 mental health-related books, Optimize Your Body, Heal Your Mind, and Set on Edge. Okay, in these books, I share my integrative protocol for addressing mental health-related concerns. But most importantly to me, and I'm hoping to this audience as well, I am a Seventh-day Adventist Christian who has studied Christ's method of healing and who wants to share what I've learned with other SDA healthcare professionals so that we can help individuals obtain optimal physical, mental, spiritual, and social healing and introduce people to the Three Angels messages and the hope for a better future. Okay, so without further ado, let's jump into our video. So now we're going to talk about thyroid dysfunction, and our key hormones here are T3 and T4. So the thyroid hormones triiodothyronine and thyroxine play important roles in metabolism, growth, and development. Okay, so TSH, thyroid stimulating hormone, is a measure of thyroid function. Okay, the conventional range for TSH is 0.45 to 4.50. Okay, and within that range, a value below 2.5 is desirable, and a value between 0.9 and 1.5 is optimal. So when you go to your doctor, if you run a TSH, if your number falls between 0.4 and 4.50, or if your patient's numbers fall between 0.45 or 4.50, then you will see on the lab result sheet that it is considered normal. It will not be flagged if it is in that range. However, optimally, we want to see that number between 0.9 and 1.5. And I'll tell you why. Okay. So here, let's just review. So hyperthyroidism. So a hyperthyroid state is where your TSH is going to be technically below 0.450. Okay. So this is where you have hyperthyroid symptoms of an overfunctioning thyroid. Okay. So above 4.500, you're going to have hypothyroidism. So these are symptoms of a suboptimally functioning thyroid. Okay. And then the normal range is 0.450 to 4.500. But the optimal range within that normal range, so where you really want to see that value, is between 0.900 and 1.500. All right. Let's talk a little bit about the symptoms of thyroid dysfunction. Okay. So in the hypothyroid state, so this is where the TSH is above 4.500, we're going to see symptoms such as depression. We're going to see weight gain or difficulty losing weight. We're going to see fatigue, constipation, menorrhagia, so heavy menstrual bleeding if it's a female and she is still menstruating. We're going to see dry skin. We're going to see brittle hair or abnormal hair loss. These are all symptoms of a suboptimally functioning thyroid. Okay. And then when it comes to hyperthyroidism, when a person is in a hyperthyroid state, then what we see is a little different. What we see is, and again, this is where the TSH is below 0.450. Okay. So when you have a low TSH, then your thyroid is over functioning. So it's kind of like crisscross, So here you see symptoms such as anxiety, irritability, weight loss, and it's often extreme. So a person will lose a lot of weight if they're in a true hyperthyroid state. Okay. You're going to see fatigue, you're going to see loose stool, diarrhea, mood swings, you're going to see excessive hunger, and also excessive sweating. These are all symptoms of hyperthyroidism, okay? Now, why did I say that although the normal range is so broad, the optimal range is actually much more narrow. Here's why. This is a statement from the American Association of Clinical Endocrinologists, and this is what they have said. Even though a TSH level between 3.0 and 5.0 is in the normal range, it should be considered suspect since it may signal a case of evolving thyroid underactivity. So they're saying like, hey, I will point out here that sometimes, depending on the lab that you use, the normal range may be up to 4.50 or maybe up to 5. So that's why they're saying 5 here. So they're saying, hey, even though from 3 to 5 is still technically considered normal, this could be what the value looks like when a person is developing a thyroid disorder. Okay. And so we should evaluate further. This is, again, the American Association of Clinical Endocrinologists. Okay, so let's take a look at this study because this is really important, okay? Or this journal article. So this is really important. This is again based on that NHANES survey or study, the NHANES 3 study that we referenced earlier. And this one is called Thyroid Stimulating Hormone Thyroid Peroxidase Antibody Relationships Demonstrate that TSH Upper Reference Limits may be skewed by occult thyroid dysfunction. Okay, so what does that mean? That essentially means the exact same thing that the American Association of Clinical Endocrinologists just told us. Okay, the exact same thing that I've been telling you. Essentially, the upper range of that normal range is really suspect, and we should be expecting for optimal function our patients and clients' TSH values to be on the lower end of that spectrum. So let's see what it says here. It says TSH upper reference limits may be skewed by TPO antibody negative individuals with occult autoimmune thyroid dysfunction. Okay, so what does this mean? It means that the upper reference limits, it essentially what it means is that when they came up with the normal range for the TSH value, there were some individuals who later went on to develop autoimmune thyroid disorders. However, at the time, they appeared to not have a thyroid disease. So they were included in the normal individuals. And this is kind of how they came up with the normal range, okay, by evaluating a bunch of people who appeared to be normal and then saying, hey, on average, normal looks like 0.45 to 4.50, okay? But when they later found out that these people had brewing autoimmunity, like their TPO antibodies may have been negative, but they still were in the early phases of an autoimmune dysfunction, that led to them realizing that, hey, our reference range is technically skewed. Okay, so TSH upper reference limits may be skewed by TPO antibody negative individuals with occult or hidden autoimmune thyroid dysfunction. Okay, so this is the same thing that they were telling us previously. Okay, now, does TSH reliably detect hypothyroid patients? Okay, this is important. And the reason this is important is because when you go to your doctor and you get your annual labs, you're most likely going to get a TSH value done. Some doctors will do a TSH and a free T4, but some of them will only do TSH, and will only do T4 if that TSH comes back outside of the normal range. Okay, and that's it. That's the extent of, for most people, the extent of thyroid testing that people have done. And that is a problem. And I'll tell you why. Okay, so let's look at what this says. Does TSH reliably detect hypothyroid patients? It says, although measurement of TSH is a convenient screen for thyroid function, it is influenced by many factors that may affect its overall reliability. We believe thyroid function should be assessed by more than a single test. Amen. Okay. This is what I've been saying for years. This is what I've been doing in my practice for years. This is what I want you to be doing in your practice in order to give your patients the best care and to help them optimize their health. Okay. Optimize, not just normalize, but optimize, to help them live optimally, to help them live the life that God created them to live. Okay. Okay. So let's look at a case study. So this is Jenny. Okay. Jenny was experiencing depressed mood, and she went to her provider. She was diagnosed with low vitamin D, and she was given vitamin D supplementation. the pills. She took the pills and her mood lifted a little bit, but she knew she still wasn't functioning optimally. Okay. So Jenny came to see me, and this is what we did. So we recommended lab testing. And when I talked with Jenny, I found that she was experiencing specific symptoms that were suggestive of hypothyroidism or a suboptimally functioning thyroid. So I recommended some lab tests, a more in-depth look at her thyroid, okay, and some other tests as well. And when we got the results, we found that although the TSH was in the normal range, Jenny actually had antibodies that were attacking her thyroid gland. She had an autoimmune thyroid disorder. Okay. So, and this is a significant contributor to depression. Okay. This is called Hashimoto's thyroiditis. So she had Hashimoto's thyroiditis, an autoimmune thyroid disorder that causes fluctuations in thyroid levels, but eventually it settles down into a hypothyroid state. And Jenny at the time was experiencing a lot of hypothyroid symptoms. Okay. And so what we did was I recommended several herbs in order to help normalize her thyroid function. And so, and to improve her symptoms. So the herbs that I recommend, the main herbs, I should say, that I recommended, there were others as well, but the main ones, the key players here, were Withania somnifera, which you may know as ashwagandha, Coleus forscholi, which is Coleus, Schizandra chinensis, Schizandra, and I also recommended selenomethionine. So this is selenium, and it is 200 micrograms per day. So the reason I recommended selenium is because selenomethionine has been associated at this dose of 200 micrograms per day, has been associated with reductions in these TPO antibodies, these thyroid peroxidase antibodies. So it helps to calm the autoimmunity and slow the destruction of the thyroid gland. Okay, so that's what we recommended. And this is what she said. So Jenny ended up saying, because of Focus, again, Focus Integrative Healthcare is the name of my practice, because of Focus and their dedication to listening and searching for root causes, they were able to help me obtain a proper diagnosis and treatment plan. I have been suffering from Hashimoto's disease and was unaware. I am extremely thankful that I am now feeling much better because of the nutritional and herbal information that has been provided to me. Okay. I had been sick for a couple of years, and I was at the point of not even being able to spend time doing any of the things I used to do. Happiness and laughter had been gone for a long time, but recently, after making the changes recommended, I have increased energy. I am not as depressed, and I'm able to wake up early and to have my devotions again. I now have the desire to exercise and to make better health choices, and I am laughing again and smiling. This is the work that God is calling us to. He is calling us to be co-laborers with Him to help people to obtain optimal physical, mental, social, and spiritual well-being so that ultimately they can come to a more true knowledge of Him and be prepared to spend eternity with Him, And so now, we're told we've come to a time when every member of the church should be a medical missionary. Not everyone should understand these things on in quite the same detail or on quite the same level as what I'm explaining here. But if you believe that God is calling you to a deeper understanding of pathophysiology and of how to help people obtain optimal physical, mental, spiritual, and social well-being, and with an emphasis on the mental health, which again, as I've mentioned, is like a rich part of our history, then I want to remind you and invite you to complete the form in the below this video and reach out, because if that is your goal, if God is impressing you to do that, then I want to be able to help you do that. Okay. So yeah, so let's continue. So now we're going to look at other mental health concerns. We've been talking a great deal about anxiety and depression. Now we're going to talk a little bit about bipolar disorder. Okay. So this study is called Adjunctive Thyroid Hormone Treatment in Rapid Cycling Bipolar Disorder, a double-blind placebo-controlled trial of levothyroxine and triiodothyronine. Okay. So in this study, just to set you up, give you the background, they're looking at individuals who have rapid cycling bipolar. So this means that they cycle pretty quickly between mania and depression. Okay, so multiple times they have go through multiple cycles in a year. Okay, manic state, depressive state, manic state, depressive state. Okay, and what they're doing here is in this study they're trialing thyroid hormone to see if giving thyroid hormone is going to improve the rapid cycling. Okay, so let's see what it said. It said the findings in this first double-blind study directly comparing the effects of levothyroxine and triiodothyronine therapy against placebo provide evidence for the benefit of adjunctive levothyroxine in alleviating resistant depression, reducing time in mixed states, and increasing time in euthymic states. So essentially what this means is in these individuals, when they gave them synthetic thyroid hormone, okay, they saw that their depression improved. They spent less time in mixed states, so states where they are experiencing manic symptoms and also depressive symptoms, and they spent more time in a euthymic state, so in a state where their mood was good, where they would describe their mood as good. Okay, so it had a positive effect on their health when they regulated their thyroid function. Okay, so here they gave Synthroid, a levothyroxine, but there are other ways to optimize thyroid function. In many cases without giving Synthroid to individuals, okay? So let's continue. Our key takeaways from this section are suboptimal thyroid function can negatively impact mood, and in patients experiencing mood-related concerns, optimizing thyroid function can significantly improve these symptoms, okay? So what are our takeaways for this section, okay? Number one, be proactive, okay? We need to be proactive and investigate further when patients' TSH values are above 2.5, okay? If the value is above 2.5 micro-IU per milliliter, then we need to be doing more in-depth testing to make sure that there is not something else going on, okay? And I would even suggest that what I do is from the beginning, if they show any symptoms in my history, like as I'm doing the history, if they report any symptoms that make me start thinking, hey, their thyroid may be out of whack, I'm gonna, from the beginning, do in-depth thyroid testing, okay? So you can do it that way, or you can do it like after you get the TSH back, do some follow-up testing if you want to do it that way. It's up to you. But this is what I do, okay? More in-depth testing from the beginning if I have any reason to believe that they may have suboptimal thyroid function going on. Okay, the second takeaway, run additional tests, okay? We just mentioned that. Evaluate for thyroid autoimmunity and other markers of suboptimal thyroid function when appropriate, okay? And the third takeaway, optimize thyroid function, okay? Help the patients to optimize their thyroid function naturally before restoring to pharmaceuticals, okay? This is what our church has historically done. This is what even people in the world are doing now, and it is effective. And if I'm being frank with you, people pay good money for this type of approach because it is very difficult to find it anywhere else, you know? But we can tap into this by making it available to people, and also after we win their confidence, use that as an opportunity to help them improve their spiritual health. And with that, we'll close out our second video in our series on hormonal disorders that can masquerade as mental health related concerns. In our next video, we'll talk about the chronic stress hormone cortisol and how it can wreak havoc on our bodies, increasing our risk for many physical and mental health related concerns. We'll also talk about what we can do about it. You won't want to miss this video. Click this link to watch the video. See you there.